Welcome to Costa Rica. This section is the second section with Dr. Brenes here, maxillofacial surgeon, but he's actually more than just that. Those 9 years of education wasn't enough. He wanted to do more of a subspecialty, right, doctor?
That's right.
This subspecialty in cosmetics, because he already understood the face, so he wanted to get into that. But tell us a little bit about what that means and how you excel in that area.
Okay. Well, as oral and maxillofacial surgeon, we have a lot of knowledge of the facial anatomy. For example, with the orthodontic surgery, we can move or we can change the position of the.
You can move the inside of the jaws and stuff.
That's right. So why cannot we do it with the soft tissues, with the skin?
Oh, so, the easy part, right?
Yeah, that's the easy part. So I have a certification of the American College of Oral and Maxillofacial Surgery to do advanced facial cosmetic surgery.
So you went to the U.S. to start training with this, get certified. How long was that?
This certification has a duration of 3 years. Yeah.
Imagine, he went to school for 9 years and then went again to get your cosmetic in 3 years.
Yeah, that's right.
Wow. You know, I don't know how you got time for this. I think the doctor got in the wrong field. I think he should have been a brain surgeon. But you know what? I'm glad he chose to be with us on the dental side and the cosmetic. Well, tell us a little bit more about the cosmetic.
Okay. Well, here in my private practice, some of the procedures of facial and cosmetic surgery that I do is otoplasty, rhinoplasty, eyelid surgery, face and neck lift. These are some of them. There is also the minimally invasive treatments like Botox, fillers, PDO treats. Okay.
Wow, all this?
Yeah.
And so you can work inside my mouth.
Yeah, that's right.
You can work outside, and all in one doctor. Imagine that. So you've been doing this. Tell us what you should watch out for. If you don't visit Dr. Brenes, what should you watch out for? What is the complications of these things? What should a patient be careful of?
Yeah. Well, there is one thing that is very important, is the experience that as a maxillofacial surgeon we have in the facial anatomy, because there is a lot of vascular nerves that cross over the face. We need to protect. Okay, if we do this kind of procedures with someone that is not quite or doesn't have the quite experience in the anatomical field, it can get dirty. So
those of you thinking about this, having the experience of the inside to work on the outside is a benefit.
That's right.
But the greatest benefit is the experience that when you choose. Now, this happens a lot. There's a lot of physicians sometimes that practice outside their area of specialty, right?
That's right.
And when you're looking for somebody, look for somebody that's a specialist in the area that you're doing. Because what happens is that if you don't do that, you can get into some cranky stuff, right?
That's right. There is, right now, it's very common to see trainings that last 3 days in placing Botox, placing fillers, okay, without like a complete
big protocol.
That's right. Yeah.
So I guess the biggest message you want to do when you're doing cosmetic surgery, choose a person that has some experience, that have a specialty in it, but also too that a person that can respond if something happens, something goes south, that they can take care of you. Well, Dr. Brenes, thank you for taking the time to talk a little bit about this area. You know, sometimes we think that we're all beautiful, but we're all going to get old sometimes, right? So
right.
If you're getting to that point where, you know, you need a little bit of help and you're not quite as, you know what, I tell my wife that this body, this face here, I don't know why we need to even do anything, but I think we need to do something sometime soon. Maybe a little bit here, but you can't fix perfection. And you guys are perfect. But if you need something, this is the doctor I'd go with. Pura vida
Pura vida.
and take care.
Take care.